Hello everyone, this is Dr. Lowell Sala of NYC Emerging Healthcare Technology, and wherever you are in the world, I hope that you are safe and I hope that you are taking care of yourself. But before we begin, I'd like you to please subscribe to my channel and ring that notification bell so that you'll be able to hear and see every time I upload a new video. Today's topic is something that I find interesting, that I find fascinating. It is the 10 shocking medical procedures that have been done or that have been prescribed throughout history.
First up is coke or cocaine, the drug which has a strong potential for cardiovascular toxicity and is very addictive, was once used as a treatment for toothache. Extracted and first isolated from coca leaves by a German chemist Albert Neumann, cocaine was initially used as a treatment for morphine addiction. Even famed psychiatrist Sigmund Freud used it on himself and promoted it as a cure for depression and sexual impotence. In 1885, however, it became so popular that it was now sold in tonics, drops, and was used as an instantaneous cure for toothache or dental pain. And not only was it very addictive, but it also caused a loss of contact with reality and an intense feeling of happiness. In 1912, the United States government reported substantial cocaine-related deaths that by 1922, the drug was officially banned. The second drug is fenfen, or the combination fenfluramine and phentermine. Fenfluramine acts as serotonin-releasing agent while phentermine as norepinephrine-releasing agent. Initially marketed as Spondymine to manage exogenous obesity and as short-term adjunct for weight loss reduction, it was eventually known to cause potentially fatal pulmonary hypertension and heart valve problems. It was in 1996 when there was a report that patients were suffering from heart problems after 1 month of using the drug that the Food and Drug Administration eventually requested withdrawal from the market in 1997. Next up is thalidomide, arguably one of the worst medical scandals. This drug was given to pregnant women. It was in the 1960s when thalidomide was marketed as a safer alternative to barbiturates, and because it was so successful, it was used by women during the first trimester of pregnancy. Extremely teratogenic, with more than 10,000 children were affected with a condition known as phocomelia. It is not known how many worldwide were victims of the drug, but because of the disaster, many countries introduced tougher testing, licensing, and regulations requiring manufacturers not only to prove efficacy of the drug, but also to disclose all its side effects. Yes, you heard that right. Lobotomy procedures. People used to believe that severing the anterior part of the frontal lobe of the brain as a recognized treatment for psychiatric symptoms. Although the purpose was reducing the symptoms of mental disorders, it was accomplished at the patient's personality and intellect. The person was neither a person as they were left emotionally blunt and severely brain damaged. It was in 1947 when psychiatrist Snorri Warfart evaluated the trials and concluded that it was crude and hazardous in many respects. As concerns about lobotomy grew, thank God, the USSR officially banned the procedure in 1950, and by 1970, numerous countries and several US states also followed. Radium water. Manufactured in 1918 to 1928 by Bailey Radium Laboratories of East Orange, New Jersey, Raditor was advertised as a perpetual sunshine and claimed to cure impotence, among other things. It was a patent medicine consisted of a triple distilled water containing a minimum of 1 microcurie each of radium-226 and 228 isotopes. This was also the first time when an all-female factory workers contracted radiation poisoning for painting watch dials with self-luminous paint in New Jersey. In 1932, however, an American socialite, Eben Byers, died from Raditor, and when exhumed in 1965, his remains were still highly radioactive. Talk about shining! Mercury. Mercury was the remedy of choice for syphilis in the 16th century. In an era before antibiotics, it was used to treat skin disease, and even later in the 19th century, it was administered as ointments. Mercury is also a key ingredient in amalgams and as a diuretic, a topical disinfectant, and as a laxative. Blue mass, a syrup where mercury is a key ingredient, was prescribed heavily throughout the 19th century. Methamphetamine. This potent central nervous system stimulant was first synthesized in 1893 by a Japanese chemist Nagae Nagayoshi. Patented by Obitrol in the 1950s, it was indicated as a treatment for obesity. Due to being a CNS stimulant, it became so popular as a diet pill in the 1950s and the 1960s. During World War II, it was also sold in tablet form under the brand Pervitin and became known among German troops as Stuka tablets. Side effects were so horrible that the army eventually cut back its usage in the 1940s. One report even mentioned that some soldiers turned violent, even committing crimes against civilians, and even attacked their own officers. 8 is heroin. Heroin for cough. Yes, you heard that correctly. First synthesized by Alder Wright in St. Mary's Hospital Medical School, it was used widely as a non-addictive morphine substitute and cough suppressant. Common side effects, however, include respiratory depression, dry mouth, impaired mental function, and addiction. It was only in 1924 that the United States Congress banned its sale, importation, or manufacture. It is now a Scheduled I substance, which makes it illegal for non-medical use in signatory nations of the Single Convention on Narcotic Drugs Treaty, which includes the United States. You will probably think that this is funny, but as a cure for a condition known as hysteria, female patients were prescribed with medical vibrators. At the height of Victorian era, doctors regularly treated female patients by stimulating orgasm. Note, however, that this was before our understanding of human sexuality, and because of this, 16th century physicians even told married hysterics to relieve their sexual frustrations with dildos. And our last shocking medical practice, treatment, and procedures done throughout history is a practice known as bloodletting. Based on an old system where blood was regarded as humors, bloodletting, or the process of withdrawing blood from a patient, was used to cure any illness or disease. In fact, there are some documents where Islamic medical authors advise bloodletting for such conditions as fevers. One British medical text even recommended bloodletting for acne, asthma, cancer, cholera, coma, convulsions, diabetes, epilepsy, gangrene, gout, herpes, indigestion, and yes, you name it, even insanity. And yes, you name it, even famous people like George Washington asked to be bled heavily after he developed a throat infection from weather exposure.
So we just finished the 10 shocking medical procedures or medical treatments that was done throughout history. And I explicitly wanted to show this to you, to show this to everyone, show this to your friends, so that you'll be able to see how incredibly fragile the human body is. And this is also one of the reasons why we need regulatory authorities such as the Food and Drug Administration and even the World Health Organization to ensure that the laws that protect the human body is protected. Thank you once again for joining this episode, and please, if you haven't subscribed to my channel, please subscribe to my channel and ring that notification bell so that you'll be able to hear and see every time I upload a new video. Bye guys!